Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
Good afternoon, everyone. Welcome to our April 22nd, 2025 Advisory Council meeting. As you know, my name is Ms. Ruthie Tate, and I'm the chairperson for the Memphis PAC. The chairperson for Johnson City is Ms. Cynthia Blair. Thank you so much for joining us tonight and for continuing to share and participate for our monthly meetings. And we continue to support and advocate for better care for people with are at risk for heart disease, diabetes, and cancer. Now, our special guest with us tonight is Dr. Ashley Ellis. And she is returning this month to share fundamental insights on medication and supplement. She participated in the discussion on how pharmacists propose regimen that can improve well-being and overall understanding. Aside from managing the Tennessee Heart Health Network Learning Collaboratives, Dr. Ellis is a certified pharmacist and served as the College of Pharmacy Assistant, Dean of Strategic Partnership and Invocations at the University of Tennessee's Science Center. She's also an advocate for diabetes care and education. She's passionate about patient care. She's patient-focused, evidence-based, and preventative geared. We'd like to say thank you, Dr. Ashley Ellis, for joining us today, and have a good night. So you are now in the hands of Miss Dr. Ashley Ellis.
Thank you so much for joining me tonight. I really appreciate the introduction and getting to speak with you. I've been able to attend several of your meetings in the past, so I appreciate coming back again. And I've seen some of you at our other events, and I always appreciate getting to be with our community members and patients, and especially the PAC, because everything that we do for research and community services is driven by you all. So when I spoke with Gladys, she let me know that back in January, when you were all planning what you'd like to hear about, you wanted to hear more about medication adherence and natural supplements with heart disease and diabetes in mind. Those are always important, and there have been some updates over the last, few months and couple of years. And as a pharmacist, I'm always happy to talk about medication. Seems like it's always, top of mind. So we can get started. Feel free to ask questions as we go through this, or at the end. That would be totally fine too. So we're going to talk about kind of those medication adherence. So these are some of the bullet points we're going to get through tonight. But if there's anything on your mind, like I said, feel free to let us know, unmute, or in the chat box. We're going to talk about a lot of common, sorry. Gladys and I are working as a team today on the slides. The really common medications for heart health, if you don't see one of your medications on there that you have questions about, feel free to ask. Common medications for diabetes, and then the role of natural supplements for both heart health and diabetes, and then making sure that we have a collaborative approach with your healthcare providers. We want to make sure that we have open discussions about the medications, because we know that people are using them, and there can be interactions with either procedures or with other medications. So if we're having those open discussions, it can be really important. All right, so we're going to start out with medication adherence. So a lot of times you may have heard this as compliance. That's kind of how I learned it back in school, but Compliance more indicates that the patient is doing what we, the provider or whoever, told you what to do. But so we don't really use that language anymore. We use adherence because we should be coming up with your medication regimen together. So the patient should be the center of the team, and we're all working through that medication regimen together. And the goals of that are set by both the patient and the condition itself. So, for instance, with diabetes, we want to be preventing, we want to keep your blood sugar under control because we want to prevent complications. When a person first finds out that they have diabetes or hypertension or what have you, hopefully they don't have any complications. But a lot of times, and a lot of times you don't feel anything. Sometimes you might feel yucky, and that might have been what brought you in. But like with blood pressure, you might not feel anything. With cholesterol, a lot of times people will say, I feel totally fine. And that would be normal. You wouldn't feel anything at all. But the point of taking the medications is to make sure that those numbers stay controlled and to prevent a heart attack or a stroke in the future. We also want to enhance quality of life. You know, like I talk about my parents a lot. My mom she's got osteoporosis, for instance. That's one of her chronic conditions, and she's trying to build up her bone mass. And one of the goals is that she can either get an ablation or a surgery because she has a lot of back pain. And she's always talking about, I have 5 grandchildren. We asked her to go to a baseball game with us last week, and she couldn't go. So if we can take some of those medications that can enhance the quality of life and do the things in your day-to-day life that you want to do, that would be our overall goal. And lastly, we look at cost efficacy. Cost avoidance is certainly one that I think is missed a lot, but you all know what this looks like in your everyday life. So that would be something like, I went to the pharmacy and the pharmacist told me it was going to be $300, and I never picked it up in the first place. Or at the beginning of the year, it was $400, and I told them to put that back. And we never started on that medication or pursued other pathways. And a lot of times there may be an alternative. Maybe there's a generic, maybe there's some patient assistance programs we could do, maybe there's samples. But if it just stops there, then a lot of times that can mean months or years or a condition that's not managed. Okay, we're ready. Yeah, there we go. So there's all kinds of challenges and barriers to adherence. So one of them is forgetfulness. Everybody has this. So for instance, like tonight, I am not at home. And normally when I take my medicines that I take on a daily basis, I take them right before I go to bed. They're in my bedside table in a little bag. I have them. And so tonight I don't have that table. I'm not going to be going to bed at my normal time. After we get done with this, I'm going to go meet a friend that I did my master's degree with. We're going to have dinner. So anything that gets me out of my routine is something that could make me forget. Or if it's a holiday, like if I'm used to it being a 5-day week and then it's Saturday, Sunday, if my kids are out of school on a Monday, for instance, I might forget to let's get up first thing in the morning, get the medication for them, then everybody brush and floss their teeth, that kind of thing. Routine is really your best friend when it comes to medication adherence. Anything that's complex. So the evidence shows us, and back when I was in pharmacy school, we learned, I could choose any kind of blood pressure medication, for instance, if you have it. There's a whole list of things we could choose. But if I had the choice to recommend something for you that would be once a day versus 3 times a day, once a day would be better. So if there are medications that are short acting, sometimes you can give them an extended release. Sometimes we don't have choices in that, and they do need to be dosed multiple times a day. But if you have a complex medication regimen, and some people do, that can be tough. Side effects, So that can be like, I don't want to take the medicine. Again, I do talk about like my parents or my parents' friends a lot, or my patients have been like, I just don't want to take this anymore. Or every time I take this medicine, I get heartburn, or this pill is really too much for me to swallow. It's too thick or too big, something like that. Or it could be a lack of understanding. Again, my mom has diabetes, and when she first started on her medications, before she had anything injectable, just had oral medications, we would talk about her taking her blood sugar. And if it were high or low, she would say, like, I don't really know if I take my blood sugar, what's the point? Because what am I going to do anything different with the oral medicine? Not really. So it wasn't giving her any kind of empowerment at that point. She didn't really have the, I guess, in her education journey, she didn't have the tools in her toolkit to understand the point of taking those medications and taking her blood sugar. Okay, we're ready for the next one. So there's all kinds of tools that you can use in your toolbox. So one is simplifying medication schedules and streamlining them. And one thing that you can do is if you ever feel like, gosh, this is a lot for me to keep up with, and it doesn't have to be memory related or adherence related, but just kind of like, I feel like my pill burden, that's another term that we have used in pharmacy school or medical education. I feel like my medicine regimen is a lot. Doctor, talk to your primary care doctor and say, is there anything we could do to simplify it? So, one of the things on here says fixed dose combinations. So, if you have been on your medicines and your chronic conditions are controlled at the doses that you're on, one of the things that we potentially could do would be to combine two blood pressure medicines or a blood pressure and a cholesterol medicine into one pill and make sure that it's covered on your insurance, which is also always important. But if we can have those fixed dose combinations, antacids are another example of those, then that can decrease your pill burden. Instead of having to take 5 pills a day, maybe we could get it down to 2 or 3 pills a day. The times where you don't want to use these fixed dose combinations is when you're starting out a medication, because we don't necessarily know if you're getting a side effect or if it's not effective, which one it is. But if you're controlled, that's a good option. Using reminders like alarms or apps, there's all kinds of adherence apps that are really good to use. Patient education and kind of trying to find the thing that motivates you is a really good one. Like, for instance, it may not be blood sugar or blood pressure that motivates you, but maybe it's the healthy brain side of it or preventing dementia. And you're saying, all that boring stuff, exercise, keeping my blood pressure, cholesterol, blood sugar under control is going to help me prevent dementia. Today I was in a session with the Department of Health, and they said dementia is not a normal part of healthy aging. And I don't know, if I'd ever really heard it put that way. And they had it's an umbrella term for some of these other conditions, and they were talking about how most of it's not genetic, most of it's preventable, and it is all those boring things. So if we could talk about maybe that is what's would motivate you. And then the other thing is regular follow-ups. So regular follow-ups, just like if you're going to get your oil changed in your car, if you can go to those regular follow-ups, schedule the appointment before you leave your doctor's office, or nurse practitioner or PA, before you leave every 3 months or 6 months, whatever your schedule is, so that you can check in. That really helps to prevent a bigger problem later on down the road. And your doctor or provider can check in and see if anything needs to be changed at that time. Okay, we're ready for the next one. All right, I wanted to throw this in there because these adherence supports. So a lot of times we do pill boxes for ourselves, or maybe we have an adult child or family member, friend to do these for us. But in Tennessee, if you have one of the plans like Exact Care Pharmacy or PillPack by Amazon Pharmacy, they take the Tennessee provided Medicare Part D plans and a lot of the Advantage plans. So it should not cost you extra. But if this is something that you're interested in, they can add on packaging services for 30-day supplies. Typically, they do not do 90-day supplies because things can change, but they sync up all your medications and package them for 30-day supply. And they come in a little plastic sleeve. If you take medicine in the morning and the evening, or three times a week, or what have you, it would come in these boxes that kind of look like this. And so you would have a pharmacist or a technician checking this for you, so there wouldn't be mistakes. And again, I'll go back to my mom and dad. They do their own. They live in a different state, but there have been times where they took each other's pill boxes. They take totally different medicine. So that is not great. But if you could have that, labeled by the pharmacist, checked by the pharmacist and the technician, and it's already packaged for you, then you would know each day with your name on it and what medication you took, and be able to visually see if you took it or you didn't take it. And you could kind of cut off like a week of it if you want to go on vacation, and you don't have to take those big boxes with you, which is great. All right, so let's talk about some medicines for heart health. You may see some that you recognize here. All right, so these are just common medications, and I'm sure you've heard of some of these. This is definitely not all inclusive, but the statins for cholesterol, they primarily lower LDL, or what we call like lousy cholesterol or bad cholesterol, but they also reduce the risk of heart attack and stroke. So some of those examples would be like Lipitor, atorvastatin, Crestor, rosuvastatin, simvastatin, or Zocor. There's several others in this drug class. The most common side effect with these is leg pain. And so people will say, like, I can't take these, or they'll take it for a few days and then they're off of it. What I will say is work with your doctor, or if this is with your cardiologist, work with them, because they work for cholesterol, but they have anti-inflammatory properties. So if there's some dose, if your doctor has determined that you need one of these medications, if there's some dose that you could tolerate, then there is evidence that maybe if you could take it every other day, that you would still get the anti-inflammatory benefits. And we're not necessarily chasing a number. And as far as natural medicines, the way this works on your cholesterol pathway, because cholesterol is produced in your body, and that is what makes up your cells. So a lot of this is genetic. A lot of it is like if you were to look at your parents' lipid levels, yours probably look a lot like that, and we can only alter it so much. And what it's depleting is CoQ10 in that cascade. CoQ10 is available as a natural supplement. So for some patients, you can supplement CoQ10, and it helps to alleviate this leg pain. If the leg pain is like, I feel like I worked out at the gym yesterday, I could live with it, it would be okay to keep taking it. If the leg pain is like, I can't get out of bed, or I have a change in my urine color or stool color, something like that, that's where we need to stop taking it and seek medical care. Okay, the ACE inhibitors are going to be any blood pressure medicine that end in that PRIL. So these medications are a lot of times used first line for blood pressure, lisinopril, benazepril, ramipril, those are examples. But they're also used in patients who have diabetes to prevent kidney problems. One of the side effects that people can experience with them is like a dry, hacking cough. If you get that, then it's probably not going to go away. What I would tell you with that is, if it is something that annoys you, which it would annoy most people, we still need to have the kidney protection. We still need to have your blood pressure controlled. I would talk to your doctor and see if we could get something that's called an ARB prescribed instead. And they're also available in generics and switched over. But I wouldn't abruptly stop taking it or wait till your next 6-month appointment and live with that cough either way, because there are alternatives and they are great medications, and not everybody gets that cough. Beta blockers are another one, OL at the end. These medications are something, propranolol, atenolol, carvedilol. They are medications that work in the heart. They can also work in other parts of the body as well. They slow your heart rate. But a lot of times we prescribe these after a heart attack. They can be used for blood pressure as well. But one of the things you might notice is when you first start taking it, you have, as your heart adjusts to it, it's a little bit harder for your respiratory rate when you're going upstairs. So you might be like, I'm getting out of breath. What's going on here? Or you might feel more tired. With that, for instance, talk to your doctor, but most people do adjust to it after a couple of weeks. But if it's something that, you're falling asleep at your desk or you feel like it's a lot of fatigue, I definitely would talk to your doctor and see if there's a different one you could take. Okay, we're ready for the next one. Okay, so all of these medications work in different ways. And if you're taking more than one blood pressure medication, it's really important to know. So some directly lower your blood pressure. Some, like we said, work in the kidney. Some decrease how much your heart is pushing against your blood vessels. Some improve blood flow. But the thing with blood pressure medicine is it doesn't build up over time. If you forgot to take it today, it's not in your body anymore for the most part. So your blood pressure is not protected today if you didn't take it today. Even if you took it for every day for 6 straight months before, that has protected your heart from working too hard during that time. But today we don't have the protection from blood pressure. So it's really important that we take it every day as much as we can. And you know how I was mentioning before, like if I have a day that's off, like let's say in the fall, my youngest child plays basketball. So a lot of times he has a basketball game first thing on Saturday mornings. That throws off my schedule. If I were taking blood pressure medicine and it threw off my schedule every single Saturday, that would be a big chunk of the month. So I would need to come up with a plan to make sure that my blood pressure was taken care of, or I took that blood pressure medicine at a different time of the day. So that's really important to kind of think through your week and what time of day is the most consistent for you. Okay, next one. All right, side effects and monitoring. I think the most important thing here really is make sure you're monitoring potential side effects. You can have some dizziness, some fatigue. You can have some GI issues potentially, but I think self-monitoring blood pressure is really important. And normally on those home monitors, you can see your heart rate as well. Blood pressure and heart rate can change multiple times over the course of the day. We all know that if you're exercising, if you're not, dependent on your mood, if you're stressed out. And so get to know what your blood pressure is like, and you'll be able to tell if it feels different or if it doesn't. And then that way you can take those types of numbers with you to your doctor's visit and say, I've noticed it being trending up or trending down, or I'm well controlled. I think that's really important. And with your side effects too. Anytime you start something new, if you have side effects that are out of the ordinary, it's important to talk about if it's something, I never want to use the word normal, but if it's something common or if it's something serious. So you want to be able to know the difference between those two things. Okay, I'm ready for the next one. All right, so we'll go into diabetes. So diabetes has a lot of different medicines, right? And I kind of broke down some of the drugs here, mostly thinking with like type 2 diabetes in mind, but this could apply to a lot of different ones. So metformin is typically where you start with an adult who is diagnosed with diabetes, type 2 diabetes. So metformin is an insulin sensitizer. It works in the periphery of the body. It makes all of your cells to be sensitive to your own insulin that you make or any insulin that you give yourself. Does anybody know or anybody heard of what's the biggest side effect that people have with metformin? I think
Pain, I think pain, stomach pain instead of.
stomach pain. I think I saw somebody else say something too. I saw somebody say diarrhea. Hurts your stomach. Okay. So let me tell you with metformin, it is a great and effective drug. It's cheap and it gives you a lot of bang for your buck with your blood sugar. But it can hurt your stomach. It can hurt your stomach. So, what are we going to do about it? So, the main thing I think with it is if you're ever going to start metformin or if you know somebody that's going to start metformin, there's a few things you can do to approach it. I would say start low on your dose, go slow on the dose is number one. Number two, you got to eat with it. You cannot take this on an empty stomach. Number three, see if you could take an extended release version instead of an immediate release version. So that would be like metformin XR or ER, because it's going to be released over a longer period of time instead of immediately that big dose open in your small intestine. And most people, their stomachs do get adjusted to it over time. So, like if we did a slow dose over a month or so, eventually you're going to be okay. This can lower A1C about 1.5, maybe even 2%. There's nothing else on the market that can lower it that much, especially that's that cheap. So it's important that we educate patients at the very beginning. Sulfonylureas are things like glipizide and glyburide. These are older drugs. They're also cheap. As far as what the new guidelines say, they stimulate the pancreas to release insulin. By the time most people are diagnosed, their pancreas is not producing that much insulin. So they're not typically effective, but they can cause low blood sugar. And so it would be nice if we could stay away from them, but there are people that are still on them because they're cheap. Insulin is pretty self-explanatory. It replaces the insulin that you give yourself. It is expensive, but it will work. And the typical side effects with that one would be you can be more hungry, you can get low blood sugar, you could gain weight with it, and you've got to inject it for the most part. There's some inhaled insulins, but so you've got to learn how to inject yourself, and a lot of people don't like that. And then these others, you've heard about the GLP-1s. They can cause weight loss, they can cause nausea, but they're very effective. The DPP-4s like Januvia, Onglyza, those are also effective. They cause about a 0.5% A1C loss. The SGLT2s are great for heart failure. And then we've got all the combination drugs. So we talked about fixed dose. Okay, we can do the next one. All right, so the most important thing is if you went from not having any diagnosis to being diagnosed with diabetes, I would highly, highly recommend diabetes education, because a person diagnosed with it a lot of times will end up with maybe 3 or 4 medications, and you need to know the side effects of each and make sure you know why you're taking each one of them. Know if there is a low blood sugar risk. So high blood sugar has a risk in the long term for complications for your body, for sure. All those complications you think of with diabetes. Does anybody know any of those you can think of?
Repeat that again for me, please.
Yeah, what are some of the long-term complications of diabetes that you can think of with high blood sugar?
You can have all kinds of complications. I know this group, we've talked about all these before, everything from stroke to, amputations to.
Yeah, they can
Problems
do
with your
kidney
eyesight.
problems too. Yeah.
Amputations,
Now we're talking. Okay, go ahead.
Eyesight. Everybody can't
eyesight,
put it at the same time, but problems with the eyesight as well.
yeah, eyesight, amputations, kidney failure, heart attack, stroke, everything you don't want, right?
Yeah.
Yeah, so that's what happens if you have high blood sugar. But when you're taking the medications, you could have hypoglycemia really acutely or really quickly. And that's risky in the short term, especially for our patients who are over age 65, because you could have a fall, you could have a broken bone, you could have a car accident, you could hit your head. And so ideally, we would like for you to never have hypoglycemia, which means blood sugar below 70. Does that make sense for everybody?
Mm-hmm.
Okay. All right, we're ready for the next slide.
Sorry, it doesn't want to go to the next slide. Okay, there we go.
Okay,
Sorry.
so now
Thank
we're going to talk about natural supplements. And if, like I said, I've included some, but if there's some that you have off, the top of your head, just let me know. So I talked about CoQ10. I would recommend that for sure with statins. You could take that if statins are prescribed to you, or if you start to experience some of that leg pain. Now, omega-3 fatty acids, the evidence for that is a little bit up and down. There are some prescription omega-3 fatty acids that you could get, and insurance coverage for that, again, is back and forth. The primary evidence for that is for high triglycerides. Now, the risk with taking omega-3 fatty acids is if you take a high enough dose sometimes to get the triglycerides to come down, which, by the way, the high triglycerides are tied to high blood sugar a lot of times. You'll see those in the same types of patients. It can increase the risk of bleeding. So for a lot of our patients, that's not a huge deal, but if the patient were on Coumadin or any DOAC medications, heparin, if they're hospitalized, if you have a surgery coming up, and they ask you, have any of your medications changed? They may not see omega-3 fatty acids on your, chart from Walgreens or on your insurance, but you would need to disclose that. And then they could say, okay, stop taking this 1 week before your procedure, just so that they would know. And the same thing with garlic. Garlic can have some effects with lowering cholesterol and blood pressure, but it can also increase bleeding risk in high enough doses. So again, another risk is if patients are taking antidepressants, some of those can increase the risk of stomach bleeding. So with omega-3 fatty acids and garlic, that would be something to look out for if you had like a colonoscopy coming up. If you were taking that, or even any of the natural antidepressants too, could increase the risk of bleeding. So any questions about those? Okay. All right. These are just like a couple of caveats. This is what we always learn in pharmacy school. Like any pharmacist is going to kind of tell you these things. So natural supplements sometimes can cause unexpected side effects, and they are not regulated by the FDA. A lot of times if you buy them, they're going to have that statement that says, this is a natural product. It cannot cure, diagnose, mitigate symptoms of any disease. You're going to see that statement on the side. And that's because they're not considered drugs by the Federal Drug Administration. So that's why they're not going to say this is approved at this dose. It treats this. Okay. So they're considered natural products. So what that means is if you buy it, we could not guarantee that from bottle to bottle it's the same, or from capsule to capsule it's the same. But there are some things that you could do to make sure that doesn't mean it doesn't work, first of all. But there are some recommendations like your provider or your pharmacist would say. I would not recommend purchasing most of them from like a gas station or some of those places. And the bottles that you could, if you turn them sideways, if it has a USP label, that's United States Pharmacopoeia, that's the seal of approval. And what they're saying is the active ingredient that's inside has been verified. So if it's berberine, it is berberine. We can say that. I wouldn't say don't buy something online necessarily. I've bought things online, but I would just kind of verify your source. And just because you spent $50 on it instead of $10 on it, it doesn't mean that the $50 one is better.
Right.
So again, keep that in mind. All right. So next one. I think I covered this. So the labeling, if it says anything on there that's like, it could say promotes prostate health, but it could not say treats BPH. If it says something like that, I would not buy it, because that means that it's violating what the FDA labeling laws say, and will probably be taken off the shelf. Okay, next slide. All right, so comparing the supplements and prescription medications. So prescription medications in our country and in European countries, a lot of different countries, they have to go through at least 3 phases of drug trials and millions of dollars in lab testings and human testing and all these kinds of things before they come to the market. And then we have phase 4 trials. And we all have complaints about how expensive drugs are. And I agree with you, I hear you, and all that kind of stuff. But the supplements don't. So if I wanted to, I personally could start a lab company and have natural supplements, and I could put whatever on the outside of it and say that it treats, blood sugar support, or I could say that it's prostate support or whatever on multivitamins. And there's nothing to prohibit me from saying that, versus all of the testing that has to happen on prescription drugs. But again, that doesn't mean it doesn't work. Supplement efficacy is more anecdotal, but there is not much incentive to test it either. Because if there were a company that wanted to put it through those 3 or 4 versions of those trials, they're not going to make any money on it, because they can't make any money on it. So you can see kind of both sides of that. The main thing is, which we've talked about, is the collaboration with your provider. If you are going to take one, and I've had providers to recommend to me, like, to use this, that, or the other over the counter or supplement. This has been helpful. Just make sure that they know that you're taking it so that they can look through your other medications and see if there's an interaction. Okay, the next one. All right. So as far as the evidence, what I would say is you can kind of read through this, but what I would say is I would not stop taking my prescription medications in order to take the natural supplements. I would continue to add on other non-pharmacologic therapy and things that are free. This is kind of the way I think about it. Things that are free, and if it doesn't have side effects, that there is evidence for: mindfulness, deep breathing, healthy cooking, being outdoors, social connections, all of those things we know that are there. But if you want to try one of these other things, most of the time it won't hurt. Sometimes it could, and it's possible that it could help. That's kind of the way I would think about it with the evidence. Okay, the next slide. There are potential risks and interactions, particularly at high doses, and particularly if you take a lot of medications. And I know I said this before, but I'm going to say it again. Always, always inform your providers before any surgeries or procedures, even if they are preventative, like colonoscopies or like if you need to have a stent placed or anything like that. Make sure that they know if you're taking any natural supplements or anything over the counter. Okay, next. Okay, and for diabetes, there's a few more. Cinnamon, even if you just sprinkle cinnamon or cinnamon sticks or something like that, can be useful in lowering blood sugar. But this is where it's important to, if a patient is using insulin or one of those other drugs I was telling you that can cause hypoglycemia, it potentially could put you at risk for it. If you're trying to prevent diabetes, there's no problem with using cinnamon to try to lower your blood sugar. Berberine, I've seen some more studies recently that it's been effective. If you have diabetes, I don't think that any of the medications should be stopped to use it, but I think it would be great for people who are in prediabetes to try to prevent it, and in addition to their lifestyle changes. And then alpha lipoic acid, that's an antioxidant that can help with insulin sensitivity. But any of these, just take caution with your other meds. Okay, next slide. And again, so I would say that kind of the same thing with the heart health medications. There's some evidence, there's smaller trials and shorter length, more anecdotal. So I'll go to the next one. I want to make sure we've got enough time for questions. I would say the biggest risk with diabetes medications is hypoglycemia. Okay, we'll go to the next one. I would say the other thing I would say here is working with your healthcare providers. So if you are a person who likes to take natural supplements or who is more inclined to take natural supplements and you feel dismissed by your provider, or you feel like they shut you down or make you feel like you don't want to talk about it, I think that might be an opportunity to find a provider that you can be more open with, because you don't want to be a provider that you're trying to hide things from. That's really important. And we talked about this at the beginning of the call. The patient is the center of the team. So if you're a person that says, hey, I don't want that prescription, I'd rather try this for a month, then you need to find a provider that's not trying to push what they think on you. And if most patients are going to do what they want anyway. So make sure that you feel comfortable with your provider. You can combine medications and natural supplements. People do it all the time with herbal medications and vitamins, but we just got to make sure that everybody knows what's going on. Okay. And a lot of the things that are in natural supplements, you can just eat. So instead of blueberry extract, you could eat blueberries. And I always want to reinforce, regular exercise, stress management. We talked about mindfulness, chair yoga, our cooking classes, and all of those things are great additions to our medications that are being taken anyway. Okay. And those are kind of the closing points. So I want to make sure we've got enough time for questions and any thoughts about medication adherence and natural supplements.
My name is Willie Morgan, and I have a question about the metformin. I was taking metformin for years, and my doctor taking me off metformin because it was damaging my kidney. And I didn't have no problem with it. It kept my diabetes under control and everything. But I didn't know it was affecting my kidney until they checked my blood and found out that I found spots in my urine. And so I had to have a biopsy done to find out what was causing, which one the medication was causing the problem. So, but I have heard other people say that metformin make stomach hurt. My son couldn't take it. He had to just come off there and find another medication for him. So, and the next question, I didn't know that when you miss a dose of your medication, especially blood pressure, that it only lasts for 1 day. I just learned something. Although my doctor be telling me, don't miss no medication. But sometimes you end up missing one. So, but I learned something. I appreciate your knowledge and your expertise.
Thank you. Yeah, the blood pressure medications are like that. No, there's some that aren't, like we talked about the GLPs. Those are once a week doses. And they really last about 10 days. But with blood pressure, the heart's like boom, it's out of there that next day.
Wow.
But yes, and you are right about metformin. You cannot take it if your creatinine clearance, which is a measure of how much your kidneys are clearing, you can't take it if it's below 30. But a good majority of patients can take it. But there is some kidney interactions with all with all medicines. There's a little bit like, I got to make sure this patient has this, and this, and then we'll make sure they can take it.
Right.
Yeah.
Thank you.
Yeah. Thank you.
Okay, I'll try again. I'm sorry, I didn't know that I had muted that while I was speaking. I have peripheral artery disease, and I have a lot of leg pain, but I take statins. Should I be taking a CoQ10, and is there a prescription equivalent for the CoQ10? I understand CoQ10 is strictly a supplement, right?
It is, yes. So you can take CoQ10 over the counter, and I think it would be it's good for heart health anyway. So I personally wouldn't see a problem with you taking it. Now you may still, and you probably will still have PAD related leg pain, but CoQ10 is depleted by statins, and it also, there's evidence that it is good for heart health. So I think that it would be fine, and there's not too many interactions with that. But I definitely would let your cardiologist and your
I
doctor
would.
know.
Yeah.
Yeah.
Okay, thank you.
Dr. Ellis,
Yes, ma'am.
if you don't have any evidence of that you have heart problem, is it a good idea to take um, supplements for that? Just because.
Well, if we live long enough in general, like most of the time they tell, this is the way we learned it in pharmacy school. If you live long enough, you probably, whatever your age is, like if you're 70, there's a 70% chance that you'll have hypertension. You're 90, there's a 90% chance you'll have hypertension. So if you don't, you're doing a lot of things right. So I think like it would be like your calcium and vitamin D. Like all women need to have that for sure as we age because our bone density will decrease after menopause. That would be a good one to take. A multivitamin would be a good one to take. Omega 3s are not a bad one to take. I personally don't take it because I go back and forth if I have a fish allergy or not. And it's hard to find an omega 3 that's not from a fish source, but you can find it. I mean, the other thing you could do is like eat walnuts. So a lot of these you could, if you're wanting to have a source of it, you could find a food equivalent and say, I'm going to have walnuts for my snack every single day at 3 o'clock. But I think it's a good thing to be cardio protective from the beginning.
Okay. Thank you.
Mm-hmm.
This is Vanessa Comer. I don't have high blood pressure, diabetes, pre-diabetic. Yes.
Mm.
I every now and then I'll have some issues with swelling in my ankles. And what I've noticed is that I have not been consistent with my vitamin D3 because I'm not prescribed vitamin D3. But I noticed when I've not been consistent and I've been off of them, I will have the swelling in my ankle. And so that kind of lets me know that supplements also are important. And if you're going to take them, if they are helping, that you be consistent with them. Likewise, and timing is important as well. But the question I want to ask you is about flaxseed oil.
Mm-hmm.
Where does it fit into? Because a lot of what I take is for inflammation. And so that's one of the things along with the vitamin D that I find that helps me.
Yeah, so
Do
flaxseed oil would be another good one that you could take for overall heart health. And it also has some fiber in there, so it's good for the GI tract as well. But another, like, if you didn't want to take that supplement, you could put flax seeds on oatmeal every morning if you
right.
wanted.
I was doing the flaxseed on the like oatmeal and stuff like that, but I found that it didn't. I mean, I found that I had, I was battling the inflammation more with the flaxseed versus the flaxseed oil. The flaxseed
Mm-hmm.
oil seems to work a lot better, and so
And I think some of that is everybody's different,
uh,
and you know, it's some of it's like for instance, my daughter has eczema, and it should be like, well, Vaseline should help everybody, but for her that breaks her out. We got to use this other kind of lotion. So I think if that's what helps you, you should use it.
right. Okay. Thank you.
Dr. Ellis, can you speak to juices as an aid with things like blood pressure and maybe high cholesterol? Because I've tried beet juice and I've tried cranberry juice in an effort to improve my blood pressure. And I've
Okay.
had some kind of erratic results with both of them.
Like, are you making them yourself or
Oh
purchasing
no,
them?
I purchased them at Sprouts. I tried to, try to get the kind that isn't not the ocean spray cranberry juice. but the ones that don't taste sweet, even though they have sugars in them, but they're natural sugars and they're not sweet.
Mm-hmm.
Mm-hmm.
So yeah, so with the juices, they are the fruits, so you've got the fruits or the vegetables or what have you, but
Mm-hmm.
they've removed the fiber. And
Right.
so the problem with that is that they're metabolized pretty quickly, even if we don't have the added sugar. And like with cranberries are pretty bitter if you don't add, sugar to them. So like if you put them in a
Yeah.
smoothie or something, I always have to have like a little stevia or something. But
Yeah.
because we've removed the fiber from it, the body kind of views it as sugar. And so your blood sugar goes up pretty quickly and it drops pretty quickly. And you know, you're still getting the antioxidants and you're still getting all of that, the vitamins from it, which is good.
Mm-hmm.
But what would be better for the blood pressure would be to consume the whole fruit if that's a possibility.
Oh, okay. Well, okay. So it better to just eat the beets or eat
If
the berries.
Yeah, because then you're going to get the antioxidants, the vitamins, the fiber. It's going to be slowly digested
Mm-hmm.
and you'll get all of that kind of goodness together.
Okay. What about pickled beets? Does it matter if that's usually when I eat them,
I
I eat that kind.
I think so. What I would tell you to do is, now I love a pickle, but I would tell you to look at that nutrition facts label and look at the sodium on there
Oh,
because most likely the sodium is pretty high.
and that's
Um,
the purpose.
but I mean, I could be wrong because I'm not as familiar with that particular item, but
Mm-hmm.
we need to, blood pressure and sodium are kind of like they go hand in hand.
Mm-hmm.
And
Right. Yeah.
if I can add something to that, Ashley, I've been teaching diabetes classes, as some of you know, since like 2016. And that is something that I really kind of stir people away, just like Dr. Ellis said, don't eat the fruit or the vegetable instead of the juices, because they've taken everything. And some of the juices, even though they say no sugar added, naturally they're as much sugar as a Coke.
Mm-hmm.
And no, really, you don't get, like Ashley said, the fiber and everything. So I always really stay away from fruit juices. So
Okay.
anyway, just wanted to add that.
Added sugar. Okay.
Yeah.
Okay. Thank you.
Miss Sandra Williams. Dr. Ellis, you mentioned early on in your presentation that some things that we consider just signs of aging and we accept as the inevitable are actually preventable. And you mentioned dementia.
Mm-hmm.
Is that actually preventable, or is it just what we can try to extend the time? Is it actually preventable?
So a lot of the new research, I'm hoping that we can spend a little bit more time on this over the next year and a half or so. But um, with brain health, um, now there's some of it with dementia that is either genetic or age related, but a lot of it can be either preventable or can you can delay it. But like there was a new study this past year in the UK with like 250,000 patients in it, but the things in that study were blood pressure, cholesterol, blood sugar, exercise, healthy eating, all this boring stuff that we talk about all the time. That's what I say, all the boring stuff. And then the other things in there were social connectedness and loneliness, which the way that they asked that in the survey tool is, do you have 2 to 3 people in your life other than your spouse and your adult children who you could talk to about a problem or if you had a health related problem? And so the people that could answer those questions and then had those clinical outcomes controlled, they had dementia prevented or didn't have it at all a lot later in life than the people who were lonely and not connected socially and that kind of thing. So, exercise, get out in the sun. It's everything that we know. But Alzheimer's is just one part of dementia and healthy brain. There's all kinds of things like flossing is another one that leads to more healthy brain, more healthy heart. But a lot of things you do for your healthy heart, you also are doing for your brain.
Did you say flossing?
Mm-hmm.
Like flossing your teeth?
Mm-hmm.
How does that play in with that?
Like we're talking about things that motivate you. I always hated flossing my teeth, but on my dad's side, we have a lot of heart issues. That's how I started like motivating myself when I was in my 20s. So there's bacteria that is in everybody's mouth. And if you floss, now I'm not a dentist, so I'm just kind of giving you my best paraphrase. But if you can prevent gingivitis, essentially, you can prevent those bacteria from being in your heart and prevent gingivitis is linked to heart disease.
Okay, thank you. That is interesting.
Yeah.
Thank you.
But that motivates me to be, if you ever have a day where you're like, oh, I don't feel like flossing, and I'm like, well, I don't want heart disease.
Okay. Mhm.
Dr. Ellis,
Mhm.
Ruth Tate. So in other words, if you don't take your medications, if you have high blood pressure, high cholesterol, diabetes person, and if you don't take those medications daily, does that contribute to being contribute to you being more likely to become a person with dementia or Alzheimer's?
I don't know that. So that would be kind of like three links. So basically, if your blood sugar's controlled, if your blood pressure's controlled, cholesterol, if you exercise, eat healthy, and then you have these kind of social constructs, you're less likely. So how would you control your blood sugar? Some people may not even have diabetes, so they wouldn't need to take the medicine. But if you have diabetes, in order to achieve that control, then you would need to take your medicine. If you have high blood pressure, you would need to take your blood pressure medication every single day. I'll give you another example. Like my husband, for instance, Gladys has heard me tell this a whole bunch of times, but my husband has in his family, just his mother has high cholesterol and high blood pressure. She's had it since she was in her 20s. And I kind of just am like, it's your thing, you can handle it. But eventually, like he went back at his 3-month appointment and it hadn't changed. And his doctor wanted to go up on the dose. And I said, well, did you tell the doctor you hadn't taken your medicine at all?
Right.
And, so then he was like, I think I need you to help me. And he's kind of a forgetful person. But anyway, so I started helping him take it and like make sure he took it. And he went back to the doctor and was like, this is a miracle. I can't believe how much your cholesterol has come down and your blood pressure has come down. It wasn't really a miracle. It was just medication adherence. But basically, if you can take it every single day, then his numbers are controlled. So that's dementia prevention, that's heart disease prevention, that kind of stuff.
Okay. That's good to know. All right. Thank you so much.
I have trained my kids as well to tell them, Daddy, you have to take your medicine or your heart's going to explode. That's the other. You can use that one. That wasn't in the presentation.
Fear tactic here.
Yeah, fear tactic.
Yeah, fear tactics can work. So, and Gladys and I have talked about this many times, and she's heard me at many community things talk about this personally. But at 17 years old, I had extreme hypertension in a pediatrics office. And it didn't really mean anything to me, right? At 17, all that I wanted to do was just be a teenager and do all the stuff. I would never talk about it. My parents were upset, but it was genetic in the family. So I spent many years maybe taking the medicine or maybe not, probably more likely not taking it. And I was 34 years old and went to the doctor, and he said to me, "Are you taking your medicine?" And I said, "Yeah, I'm taking it." And he goes, "You sure about that?" And I looked at him and I said, "Yeah, I'm taking it." And he goes, "Well, I'm going to call you a liar right now because your numbers show me that you're not. And right now, your blood pressure is at a stroke level, and legally, you cannot leave this office right now until it's lowered, or you can go to the emergency room next door." He goes, "But you're not, and you're playing with fire, and you're going to get burnt, and you're going to have a stroke." So, and that was the same way in the pediatrics office. I couldn't leave legally because I was at a stroke level at 17. So I am always thankful for that man for bringing me to my knees and calling me a liar, because I was a liar and I was lying to myself. So, that day changed me, and the routine that I have to take this every single day. If I don't, it's not doing what it needs to do in my heart. And my heart has a problem, right? So, it means a lot to take the blood pressure medicine as you're directed. And then, I had a heart attack at 43. And, I kept thinking about all that time that I did that damage to myself. And I carried a lot of guilt in my life for it. And I really had to let it go and just know that I have to go forward with it, right? But I mean, it's like Willie said, I didn't realize that it came out of your system that fast. So I'm like, Willie, I learned something tonight too that really hit home, so think about all the time that I didn't even do it. I mean, it's a miracle that I'm still sitting here. It's only God.
Yeah.
Yeah,
Yeah,
Ruth the Tate. Um,
yeah,
yeah, then think about the time that you don't even take it. Then you're supposed to be taking it,
Mm-hmm.
and you were taking it like sometimes, but you weren't taking it regularly. And then
Oh
that,
no.
yeah, until to this gap where your doctor knew that you had been taking it, and then he just brought it to your attention. But just
Yeah.
think about it, you know,
Yeah.
if you had not taken it at all, you know.
Yeah. I
And
mean,
that's
that man.
a lot of us is
Yeah.
guilty of that.
Yeah.
We don't just like being a diabetic, you don't think like, hey, oh, I don't really need this, then your doctor tells you that, once your eyes and your kidneys and other parts of your organs start failing you, hey, that's nothing I can do then.
Yeah. You're in trouble, right?
Yeah, yeah. So my
Yeah.
doctor
And yeah, I
told me
think
that.
you're young too. I
Yeah,
was
and that woke
young.
me
I
up.
was invincible, right? But I
Yeah,
wasn't invincible. Nobody is.
right.
So anyway, but thank you. I really did learn something, just like
Yeah.
Willie on that blood pressure medicine. So thank you. It was good.
Thank you for sharing your story.
Any last questions for Dr. Ellis?
Um,
I would just like, oh,
no, go ahead. Go ahead.
I would just like to say something. Dr. Ellis, I thank you for the presentation. I thank you for all of those supplements as well that we can do along with our medication. I deal with blood pressure, and some of the medications you have to be careful because some of the blood pressure medication can make your blood glucose go up a little higher than usual. And I think my doctor changed me, and so that I don't, deal with that right now. But I'm taking preventive measures to try to keep from having type 2 diabetes. So, um, and I was like some of the others, thought I was invincible and not taking my blood pressure medication for about 2 years. And well, I was doing change of diet and all that stuff. But now that I'm back taking it, and I'm saying, oh, what kind of damage did I do? So
Yeah.
when I went back to the doctor, I really hadn't did any damage because I was, you know,
Free.
that I thought because my numbers were probably pretty much the same. And it probably was that I needed to change the blood pressure medication. And I just thought, but anyway, I'm glad I'm in this group because we do get a lot of information and I'm learning to stay on task to look after myself and others to make sure that I'm uh, thinking about my health every time I do something, which might be foolish, but I'm trying to take care of myself. So I thank you for giving us this time. And Gladys, bye bye. Thank you.
Yeah, I think, you know, I think that's really the key is probably a lot of us have spent time in our life not prioritizing our health, but we've got, we're here today and we've got the future to work
Right.
on it that we can visualize, you know, what do I want the rest of these years to look like? And now that I do have the information, what am I going to do with it? And I, you know, I'm thankful that you all have each other and the group too. Like we were talking about the social connectedness that you all are forming and with that information. So thank you for having me tonight.
Thank you for coming.
And if I can add something to Dr. Ms. Brown, not Dr. Brown, sorry, that's Dr. Ellis and Ms. Brown. There are some medication you were talking about, some medications or some of the that can raise your blood sugar or your blood pressure. There are some even over the counter medication that can raise it. So just be aware of that. If you have any hypertension or problems with your sugar when you're taking even like cough medicine, just anything like that, it can change your it can impact your blood pressure and blood sugar. So I just wanted to add that. Somebody else had one last question.
I had a question. You mentioned the benefits of CoQ10, calcium, vitamin D, and omega-3. Is there one source that kind of combines the attributes of them all? Or if you had to recommend one to start with, which one would you recommend that would give us the most benefits?
You know, I would probably check your labs, your most recent labs that your doctor did, and see if you have a low vitamin D or a low vitamin B12. Like if you're taking metformin, it can deplete B12 or it can deplete vitamin D. So that might be something that you want to supplement. If not, I would kind of do a really good comprehensive multivitamin would be something good to start with. That's probably what I would do,
Okay.
just to make sure you're getting something well rounded. And you probably want to take that, like if you're already getting calcium, because if it has calcium in it, and like let's say you have milk or something like that with calcium in it at breakfast, then you probably want to take that at bedtime because you can only absorb 500 milligrams of calcium at a time.
Okay. Okay. Thank you.
If I can add something to that, and thank you, Dr. Ellis, I really appreciate you being here. But I know that about a year ago, we did have a speaker to teach us how to get into our EHRs, into our health records. So we can go in there and just take a look and see where we're kind of dropping maybe on our numbers, and maybe based on that, take supplements. Sorry, my voice is going out.
Yeah, and you can ask if it's time for labs, ask them if they'll add on a vitamin D or a B12, um, if they haven't done it lately.
Okay. Thank you.
Mhm.
Anything else? Dr. Ellis, thank you so much for your time. I know you were at a
Thank you.
conference and she took time from her conference, being at work all day in meetings, to be with us tonight. So we are very, very grateful to you. I know we had her 2 years ago, or maybe 3 years ago. I know it's been long overdue. So, but we are very grateful to you. and for all your continued support. But before she goes, I want to, so she can remind me, we have some fabulous meetings coming up in May related to some of the things that she discussed with isolation and your how it can impact your health. We have another one. We have a Vanderbilt trained doctor who's going to talk about depression, mental health, and connections to heart, your cardiac health. Those are two that I can think of in the month of May, because it is mental health awareness. And I know we've talked about in January about incorporating some of those topics into our learning this year. So I will be sending those invites as soon as I have those. Did I miss anything for May? I think those are the two big ones that I wanted to talk about.
Yes, and we have community members. So it'll be a community member panel for the social isolation and loneliness, kind of overcoming that. So I think that's going to be a great session if anybody can join us.
Oh, excuse, is that class, is that on the website, or is that?
It should be coming out. I know Misa was working on the links today, so I don't know that
Yeah.
they have come out yet, but I will, but if you, I know all of you are in the distribution list from
Okay.
Misa, that from the Tennessee Heart Health, and they should be coming out as soon as those are available. But
Oh,
they are
okay,
going to be
thank you.
really good. So please join. Yes.
All right.
Okay. Thank you, Dr. Ellis. We'll let you go back to
Good
your
night.
conference. Good night.
Bye. Thank you.
Good night.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.